Greetings. Thank you for being here today. I appreciate it. As you know, you have 30 minutes. We have 30 minutes scheduled for your time period, so about half of it for your presentation and leaving half of it for any opportunity for questions that the group may have. So thank you. You may begin, Nancy.
All right, thank you. So good afternoon, Budget Committee and Commissioners. Thank you for your hard work on this fiscal year and getting us through next to the 21-22 budget. I'm Nancy Bush, and I'm the Director of Clackamas County Disaster Management. In the room with me today, I have Daniel Nybauer, who is the Deputy for Disaster Management, and on Zoom, Kathy Phelps, who is the Manager for the Medical Examiner's Office. Today, I'm here to present the Disaster Management's 21-22 budget. As all of you know, it has been a very difficult year and very busy for us. It has included 3 historic events: COVID-19, the September wildland fires, and the February ice storm. The Medical Examiner's Office also had a challenging year providing critical services to our county residents through each of these events as well. Next slide, please. Our major accomplishments for disaster response: disaster management continued to manage COVID-19 as well as the September wildland fires and the ice storm. At times, we had 2 EOCs that were functioning simultaneously. We are currently managing recovery for the wildfires and the ice storm, and that recovery will go well into next year and possibly years after that. We continue to work on damage assessments and are working through the FEMA processes for those 2 events and with our finance department. Continued reduction of repetitive loss residential property. The disaster management program staff closed a repetitive loss residential property using a flood mitigation grant, which funded 90% of the purchase, and the matching 10% dollars came from the homeowner. This is the part of the mitigation program in the department that is required to maintain if we are to receive mitigation funds pre- and post-disasters. This purchase closes the December 2015 Federal Declaration for Flooding, which provides some insight of how long many of these disasters and their recovery lasts. The fuel plan: Clackamas County Disaster Management was lead in a regional emergency fuel planning project that included Clackamas, Multnomah, Columbia, and Clark counties. Fuel needs and priorities were identified as part of the project and were based on a comprehensive fuel assessment of fleets and generators managed by local governments. Plans are drafted and will be exercised within the next 12 months to identify gaps and needs. This past year, the planning assisted us with fuel needs for the ice storm through newly built relationships in the region and with Oregon Department of Energy. Death investigations. The Clackamas Medical Examiner's Office provided a consistent level of service during unprecedented events, pandemic, wildfires, and ice storm. During all events, staff were safe by having open discussions during the events and determining how to respond, and by utilizing proper PPE, safe distancing, and managing exposure to biohazards. It is important to note here that the deputy medical legal death investigators interview family members, co-workers, friends, and others, and much of the time those interviews are face-to-face and are on scenes for suspicious deaths, including work-related, suicide, homicide, and child deaths. For the medical examiners, we also have a suicide fatality review committee. This committee was developed in conjunction with other county departments and community partners and residents, and is the first suicide fatality review committee. And it has been implemented to identify gaps with a goal to reduce the number of suicides here at Clackamas County. One of the things that's not mentioned here is that the Clackamas County Medical Examiner team also supported mass fatality during the wildland fires. They were deployed to some of the counties that were more heavily impacted than we were here in Clackamas County, and the support they provided was mobilizing and staffing the state's mobile morgue. Next slide, please. Our result measures. So first, we have 75% of Clackamas County's departments that are up to date with their continuity of operation plans, which are approved by the department directors. Thanks to the support of our county administrator, Gary Schmidt, for the first time, we hit the 100% mark this past year, or in this year. For disaster management operations, 85% of the public alert calls connected to residents is completed. The calls are sent out through our emergency notification software that is used for life safety issues such as active shooter, sheltering in place, evacuation, boil water orders, and others. The project performance for this measure is 85%, and we believe we are going to hit that mark. Disaster management activation. Reporting as of March 1st, 2021, Clackamas County staff have reported 18,538 hours to COVID response in the EOC and 6,595 hours to wildland fire for a total of 25,134 hours. The ice storm hours are not calculated here due to timing. We tracked several measures for the activations this year, and I want to mention a few other items, which is what some of these hours went toward. The number of large animals and livestock sheltered by the EOC during the wildland fire is 748. Number of RVs and families sheltered by Clackamas County EOC, we managed 2,284. Number of messages from the EOC PIO that were released on social media platforms, hits to the posts and other avenues of reaching the community was 546,208. We have many other activities that fall under this, but those are some of the bigger numbers that we have. The Medical Examiner's Office has a nationally recognized death investigation standards. So therefore, as part of ensuring quality investigations, the program management targets 4% of the on-scene investigations for review. It is expected that 95% of those reviewed will be in compliance. Next slide. The breakdown of funding for disaster management programs. Disaster management operations request $3,047,510. 83% is general funds and 14% is restricted funding. Most of the restricted funding is passed through and is not operational dollars for our program. Our program is mandated by Federal Stafford Act for federal funding support, ORS 401.305, and County Code 6.03. The disaster management activation is currently asking for $19,162, which is 100% general fund. This program is also mandated by the Stafford Act, ORS 401.305, and County Code 6.03. This particular program will range widely from year to year and is dependent on local, state, and federal declarations throughout the year. If Clackamas County has a local, state, or federal declaration in the next fiscal year, dollars will be moved into this fund to cover those expenses. The Medical Examiner's Office is requesting $1,086,199 and is 100% general funded. This program is mandated by ORS 146. It is 85% to 100% operated by the county. This program is subsidized by the state of Oregon for autopsies and toxicology testing. The county medical examiner, physician, and pathologist are all paid by the state of Oregon. Next slide, please. This is our revenue and expenses graph. As you can see, the lion's share of revenue for the department is general funding. The federal, state, local, and all other revenue is 10.5%, which is mostly passed through to Clackamas County jurisdictions, such as cities and special districts. These dollars are estimated and come from the Urban Area Security Initiative, which is the RUASI grant, as well as some other federal dollars that may come in from Homeland Security. About $160,000 is for disaster management operations from the Emergency Management Performance Grant, which we call EMPG. The charges, fees, license permits, fines, and assessment is 1.9%, which is for the emergency notification software, which we collect from other departments, and some special districts, as well as a shared position with DTD for debris management. Expenditures for the program are mostly for personnel services at almost $2.5 million, and most other expenses are for materials and services at almost $1.4 million. Next slide, please. So our summary of revenue and expenses, a few things to point out here. The federal, state, and local revenue is down 85%, which seems to be quite a bit. However, that is the line item where the house was purchased. So the house purchase was around $500,000. So of course, we don't have that revenue coming in next year because that is completed. The 99% increase for the charges, fees, and license and permits is for the shared position with DTD for debris management and the emergency notification software. General fund support is increased by 76% due to the request for 4 new staff and a 0.5 shared FTE with PGA for PIO support and other needs assessments for communication and other things here in our rural areas in particular. And also it looks a little strange there because though we're asking for more general fund this year, it says that our operating revenue is going down 17%. That's because this year we had all of the money that was moved in for the wildland fire as well as the ice storm. So of course that won't be moved in this year, but that's why that looks strange. Next slide, please. So here's our department summary for programs. We are requesting $3,638,921 from general fund and additional for FTE in our programs. Next slide, please. So our significant and financial issues. So disaster management continues to lose federal dollars, primarily EMPG, which is for our operations. Over time, that has cut deep into our program, and we've had to cut training, exercises, equipment, maintenance, recovery efforts, response, and other programs as we have seen that particular funding decline. At its height for us, it was about $500,000, and we're down to about $160,000. And that did happen over several years. The disaster activation program is actually new to us. This is the most effective way to track dollars used for disasters and response regardless of the size of the event. This is something we worked with a lot with finance on this year, and considering the year we've had, it became more and more obvious that we had to keep events separate from our operational dollars. So the adjustments will be made to this particular program as needed throughout the year and when we have disasters. Just to mention too, those disasters may be declared and they may not be, because not every disaster gets declared, but we would still use that particular program. And we will answer any questions.
Thank you very much. Appreciate that. Chair Smith?
Thank you, Nancy. You said you had a fuel plan in conjunction with the tri-counties. Can I have a copy of that?
Yes, ma'am.
I assume in that, maybe I should not assume, you have contracts in place with fuel providers in the county?
Actually, we don't have that yet. That is the next step.
Okay. And I assume that we use different types of fuel for different types of machines, cars, trucks?
Yes, we've looked at diesel, gasoline, propane a little bit. So yes, we looked at different types of fuel and what they're used for.
Years ago, when we became FEMA trained in disaster management, one of the things we were supposed to do is get contracts through our wholesale providers of the fuel. However, they may be reluctant to give county government a contract, and all these years later, 6 years later, we still don't have those contracts in place. And I tend to wonder if they will be forthcoming, not because of lack of effort on our part, is on the willingness of the private sector. If that was to happen, could there be an opportunity for us to buy and store our own fuel?
That is, it's extremely expensive to do that, and we have talked to DTD about that as well, because that obviously would help them too. But it is a very expensive project to do.
There is an ambulance provider in Oregon, second largest ambulance provider in Oregon that does that. And all of their ambulances run on diesel. Because of the cost of diesel, it's easier to store, and the engines last longer. A diesel engine lasts longer. I just put that out there, and you're right, it may be too expensive. I don't know. Just curious. Thank you very much.
Yes.
Thank you. Commissioner Fisher?
Yeah, I'm just curious. I'm interested in the death investigations. I'm curious about overdose deaths. Do we also track?
We do track, I don't have that data, but yes, we do track overdose deaths.
Thank you.
If I could remember to turn buttons off up here. I don't see any other cards up or lights on for questions, so thank you, good job.
Thank you.
And thanks for all you do, and you and your staff. It's a tremendous, offering that we have for Clackamas County, so
Yes,
Thank you.
very much.